good to see you. I miss you. Good grief. um, so we're in the holiday season, which is great. But at this point, and it's going fast, right? Zippity doo dah each day. So I'm thinking we're going to talk about what's next, right? New year, new decade. And because Gold Medical is all about the employers and the employees meeting, what about that next new terrific job? And I know you have thoughts on this.
Of course I have thoughts on it. Well, you know what? Let's not underestimate the fact that it's a new decade. I mean, it was 20 years ago at this time. I mean, I worked for a health insurance company where, the whole Y2K thing was over our heads, right? The whole world was going to blow up, remember?
Yeah.
They didn't know what was going to happen with the computers and stuff. And I have to tell you, I am sort of taken back at how fast those 20 years have gone by.
Yeah. I remember very clearly. We were in Times Square, right?
I know. So, you really have to realize that, you're about to enter the next decade, and that decade's going to go as fast as the others. So if you're not doing what you want to be doing, or if there's something that you've wanted to pursue all this time, there is no time like the present.
Yeah. Love it. Love it.
So that's the first thing. And of course, Gold Medical is a great place to go to for that. But part of the challenge is anybody who's tuning into us already has some interest in job search, or healthcare and job search, whether it's an employer looking or whether it's an employee looking. And that's a big first step, because so often, we say we want to make a change, but then the moment we hesitate, our mind fills us with all the excuses why we can't do it. Right now it's good for the children. I make good money. I like the people, but you can go on and on and on. And I recently read this book called The 5-Second Rule by a woman named Mel Robbins. I'm in the middle of it. And it's fascinating, where she talks about doing this tool, which she calls the 5-second rule. And if I can, I'll just take 40 seconds to explain it. It's where when you have something in your mind that you want to do, be it a goal or something that you should do, but you don't do, you count down from 5. You go 5, 4, 3, 2, 1. And then you physically move. You physically move from wherever you are. Whether you're sitting, you stand up. If you're standing, you take a step. You physically move. And it actually tricks your mind. It's called microcognition, which I'm just researching, so I can't go into a lot about that stuff. But it tricks your mind into closing down on all those negative things, because we are our own worst enemy, right? And there's always a reason. I mean, how many people are going to see this and say, yeah, I've been saying I'm going to change jobs for 5, 6 years. I know people like that. But they're afraid, to make the step. So try this. And again, if you get a chance, the name of her book is The 5-Second Rule, and she's Mel Robbins. It's a pretty fascinating tool, which
Robbins with 2 B's.
With two B? No, yeah, with 2 B's. When I went to the Rachel Hollis conference, she said, I read no other book, that they told you to read a ton of books, read this book. So it was good. Anyway, so then once you start, correct, you have to look at, what is it? Do you want to stay in the same profession you're in? Do you want to stay in the same specialty you're in? Do you want to change the acuity of that specialty? So, for example, if you're working in a tertiary or quaternary hospital, and you're in the ER or in critical care, are you looking to go somewhere where you don't need as much skill sets, right? Where you're not going to have as much stress? Or are you doing the opposite? Are you in a community hospital or a local hospital, and you want to get into the tertiary hospital to get that experience? So part of it is really sort of understanding what is it that you're looking to do. Travel nursing, and I know because you used to do travel nursing, is a great way to try things out. However, typically when you do traveling, you have to have some good experience in the area of expertise that you're in.
I would say 2 to 3 years. Absolutely.
Because if not, you're not going to, there's no training like you have.
No, you're jumping in. Yeah.
Right. I don't know. Are you doing a lot of internships in California now, or fellowships for nurses?
I don't know, Mary. I haven't been, the direct recruiter for that. But yes, but that's a small portion of who they're hiring for internships. And they shouldn't give up. If it's a student, they shouldn't give up. If they want ICU, if they want surgery, if they want something, they shouldn't give up. But they have to know they're one of many that are seeking that, that internship.
Right. Right.
Yeah.
Well, again, we did a lot of them when I worked here.
Mhm.
But again, let's go back to, so first thing you have to do is sort of identify, what area are you looking to change it for and why are you looking to change? I will say most people who have good work environments don't look to change because it's hard to find a good boss with flexible hours. I mean, there's lots of reasons. So you have to decide what is it that works for you. But, you still have 20 to 30% of the population changing jobs every year. So, and maybe in this market, millennials clearly are of that level. 2 years here, 2 years there, 2 years there, and they want to move on.
I think, I think it's almost like the presidency. I think 2 years, you're just getting your feet on solid ground. You've just done all your review, made some changes. And I think it's too soon to change after 2 years, personally, for me.
Right.
I worked with a gal, and she was fabulous. She was fascinating, interesting, educational. She taught most of our department how to do PICC lines, but she traditionally, and she stuck to it. It just worked for her to a 5-year change. Oh, 5 years, gotta go do something else. She was unusual in many ways. She used to go camping in Antarctica. I mean, yeah, it's a little different. Yeah. So here's the thing. I always feel like you need to take some quiet time. And I remember, you may remember this, go back in the Wayback Machine, but before we graduated, we got our publications because we didn't have the internet like we have today. But I had so many random ideas going through my head. I thought I would go to the Middle East. I thought I would go to Saudi Arabia, and be a nurse there. I thought this is a way to travel the world now that I've got this career almost wound up and tied with a bow. And what did I do? We heard about a job and we went for it because they said they were hiring.
Right.
And it was dialysis, and that was great. But that led me to a variety of things. So we were doing chronic dialysis. We were a huge center, right? We saw all kinds of patients. That led me to, well, maybe I need to know, because sometimes our patients didn't have a good day and we had to send them over to the hospital, right? So that led me to acute dialysis. Acute dialysis led me to the intensive care unit and a variety of other things. So I went all that route. And by that time, I was just about having my first kid, right, Michael? And I was doing swing float between the chronic dialysis unit and the, doing dialysis for patients in the ICU. So I did full circle there with dialysis. But yeah, so then once I had 2 children, my goals changed. Not that I wasn't happy with either ICU or dialysis, acute or chronic, all of those were good. But then my priorities changed. What was best, not just for me, but for my family. Well, I chose a job because it had 3 to 11 shifts. And then I could be with my kids up until about 2 o'clock. So we go to the library, we could do stuff, have a couple of meals together. It was wonderful. And that was interesting because when we started our job, that was the best shift, 3 to 11, 4 to 12. Did we have fun or what?
No, yeah, but you're talking about 8-hour shifts. Who does 8-hour shifts anymore, right?
Well, some of the clinic settings, outpatient surgery, yeah, not the acute areas. More often than not, you're going to do 10s and 12s. But those were the choices. My desire, I wanted to be the well-rounded nurse, right? So I wanted to do acute. I wanted to do chronic. I wanted to do elderly. The only thing I didn't want to do was labor and delivery. and
that was the first job I wanted.
I know, and you were
I never worked in it all these years. I mean, I ended up being a prepared childbirth educator, if you remember.
Yeah,
got certified for that, but I never ended up because back then you couldn't get a job in there, and now they're desperate for nurses, at least here on the East Coast. Labor and delivery.
Yes, absolutely. One of the highest needs ever is L&D and surgical nurses. Those have always been high need. Almost any nurse. There's so many jobs. That's going to be something that I'm going to start to cover for our employers and our nurses. about the plethora of jobs out there. So don't be afraid. Don't be afraid if you want to switch for whatever reason. So for me, initially it was like sort of serving my soul and serving my profession. What did I want? I wanted the whole world and so forth. And then what I was content with and what I learned from one job that led me to the next job. You know, chronic led me to acute, acute led me to critical care. So that was my journey. Some people, labor and delivery nurses are, I know for sure, labor and delivery nurses and pediatric nurses, they find their niche and they pretty much stay there. Mm-hmm. So those jobs are hard to get initially, but now they're hard to fill. There just aren't enough nurses. So
nursing school, they don't really get exposure to that. You know, when we went to nursing school in the time of the flood, yeah. You know, we worked the floors. You know, yeah. And in labor and delivery, we did a semester. We worked the floors. We had antepartum, postpartum, delivery patients. We worked it. So we came out of nursing school. We actually had a feel.
Oh, yeah.
Areas like now, unfortunately, the way the schools are set up, you know, with the way the academia is set up, they get exposed, but they don't get in. They're
no.
not putting their hands in it. I mean, we were doing IVs, by the 32nd year? You know,
yeah.
And
yeah.
Really, you know,
I remember being in orthopedic surgery and getting dirty. They didn't gear us up. They didn't give us the boots and stuff. You just stood back and hoped it didn't get in your face, you know?
Oh, I know. Yeah. I mean, even like, look at us. I mean, how many students now do a male catheterization? Remember those days?
Yeah.
You know, but you don't even get that exposure. It was, how do you learn to do that? So a lot of it is, and that's why in some of these areas, it's so hard to fill nurses because you don't have, as you said, if you're L&D nurse or a surgical nurse and you like what you do, you stay there. So that experience level never leaves. So there's no experience coming up from behind. That's why you do need internships and fellowships and stuff like that to help those nurses get up to speed.
Yes. But I think some things are transferable.
Of course.
Yeah. And I think that is something we can focus on in future videos about how you sell yourself. Okay, so maybe you don't have this particular skill, but what do you have? Like if you want to be a dialysis nurse, but your experience has all been urgent care, you know, or maybe your experience has been surgical and, well, you probably know a lot about the kidney from the inside, you know? So some things, I just say never give up if that's your dream, you know, or offer to go in at a student nurse level. You know, for let me come in for 90 days. Let's evaluate each other and see if this is a good match. Mm-hmm. You know, I'll come in at this salary so long as at 90 days you're satisfied with me, I'm satisfied with you. Now I get that bumped up salary.
Right.
So, well, what else is new? I do want to talk to you because my little pregnant daughter had a little hiccup. She's overexerting herself, and in her second trimester is having Braxton Hicks almost every night. A little too soon, isn't it?
Yeah.
Yeah. So it doesn't look like she's overexerting herself. But
you know, overexerting is a different definition to different people, Rita. Okay, you and I do overexert ourselves.
I know.
I bought weighted blankets for the spa, right? So have you ever heard of weighted blankets?
Yes.
Yeah. People with anxiety, right? We used to put weighted coats on dogs and stuff, right? So
right.
So I thought to myself, I can carry these in, not a big trouble. Well, each blanket is 15 pounds, right? So I'm walking like 45 pounds, my backpack. I'm like, what am I thinking? I can't go back. You know, this is overexerting. Stupid. She should be checked. You know that.
Yeah.
If she's having Braxton Hicks every night. She needs to.
Yeah. She needs to settle down. Yeah, but everything's going pretty good. And that was not a visit I was able to go on because I had something else going on. And it was not a visit her husband could go on. So I really feel as soon as her visit was over, I was getting that call and I was like, I need to talk to Mary about that.
Does she feel okay?
Everything else is absolutely fine.
Okay.
And in 2 weeks, she will actually see the physician. Okay, this is off topic, but it really is interesting when you have a team, and that includes maybe the physician and the nurse practitioner and maybe the RN or the medical assistant. It's interesting when that whole team comes from a different place. So my favorite practitioner is the one that doesn't overreact. that kind of has that even temper and so forth. And that's her doctor. Her doctor is a good match for my daughter because she's been doing this since she was a little girl. She's a warrior.
Mhm.
She worries. And I go, what? It took me a while to understand worry. So
Mhm.
she's a worrier, but she did not see her practitioner yesterday. She saw her nurse practitioner, not her physician. And then her MA is just absolutely delightful and has been doing it maybe longer than both the practitioner and the doctor. She's been doing it for like 30 years. She's fabulous. Anyway, she's very by the book kind of it. She just lays out information for her. I saw him.
You can't make it up. You can't make it up. I'm sorry.
That's okay. That's okay. He's the other. He's the other side of Mary. Anyway, and he's an actor by trade, right? So he had to get on
Please.
screen.
You had to
He
get a
had
move
to,
on it. Mhm.
anyway. So I was able because I've met some of the players. I actually haven't met the physician yet, but I know of her because she used to be in my OB/GYN. She used to be in that practice. But I said, great information. You're okay. The baby's okay. You want to have a discussion with the physician, and you are going to have, take the recommendations, take the information from your nurse prac, but know that she is a kind of the by the book delivers information. She's just a little, I don't want to say nerdy. She's so nice. She's so nice. But I think that her physician will give her more perspective. She won't overreact. She will give her the benefit of her experience and so forth. So, yeah, I felt bad for my little worrying daughter to get some information that she wasn't expecting. And I was sort of shocked that she wasn't telling me she was getting Braxton Hicks every night, even in our conversation. And I said, well, how often is this happening? Well, every night when I rest, which I didn't say to her, but made me think, oh, you're noticing it when you're resting
Mhm.
because they don't hurt. They just are. And anyway.
But you bring up a good point, and I'm going to tie it back to Gold Medical. Okay,
Thank you. Thank
is
you.
the lens that the practitioners look through to their patients. Are they all aligned? You
Yeah,
know, so when you are looking for a job, make sure that the team that you're going to work with sort of has a similar. Now, everybody can't be exactly the same,
right.
but you need to make sure that you can be supportive of each other's information or the way you
Correct.
give it, correct?
Correct.
So, it's better to have the physician as the person of reason, I guess.
Yeah.
But a lot of times, I'm going to talk when Susan had her surgery, as you know, we had to go see her surgeon. Now she's looking forward to see the surgeon. It's the first time she's going to see him since she had the surgery, which is now 3 months because she was in the hospital for 30 days and then the rehab for 90 days. To
Bless her
get her
heart.
out of bed, into a wheelchair, it's cold, into a car, into the hospital to get there. And then to have the nurse practitioner say, oh, I'm sorry, he's not, available. I'm going to see you, was very disappointing,
Yes.
right?
Yeah.
Now we did
She
try
had
to
any relationship with that nurse prac at all?
never met her before.
Aw.
So, I mean, people need to, it comes down to patient experience, right? And patient care.
Mm-hmm.
Somebody should have said, maybe we should ask if she wants to come or would she want to reschedule since the surgeon is here. Now, rest assured, for the second appointment, they did call us when he said he wasn't coming because we were very clear as
Yeah.
to it's not like she can hop in a car, drive herself there, hop out or whatever. It's a big to
The
do.
event. Yeah. It's a
She's
lot of
got to
pieces.
catheterize herself before she gets in the wheelchair. We got to get in the wheelchair. We got to get in the car. You know what I mean? It's a lot of stuff.
Yeah.
Um, but part of that is when you're looking at being part of a team, understanding what everybody's role in that team is, and who's really looking out for the patient.
Mm-hmm.
Really, from a patient perspective, everybody's people in healthcare tend to forget why they're there.
Mm.
I know in leadership in healthcare, like management, it's rampant. They think everybody's there to work for them. Wrong. We're all there to work for the patient. That's why everybody is here. So,
Right.
what can we do to help make the patient's life easier? What can we do to alleviate the patient's fears? What can we
Right.
do to ensure the patient's safe? Okay,
Mm-hmm.
and who's playing that role?
Mm-hmm.
I don't know. I know you and I play that role because that's how we were trained.
Right, right.
I don't know.
Yeah, I don't want to misrepresent this nurse aide. I mean, this nurse practitioner. She is, she's a quiet personality, so she delivers information. She's very kind, but every little thing for my daughter is a big thing. And I think knowing my daughter the way I know her, I would have focused on, my suggestion is, this is happening. We want this to calm down. So we're going to look at the work life and the home life and where you're overexerting yourself and make some modifications. And then we're going to talk about this again in a week or two. But to just sort of give her that information, and this kid is a worrier, I think she'll get more perspective from her physician. Just because it's just a personality thing. It's a person, very kind, the whole group is very practiced. Nobody's brand new. It's just, like you are who you are when you talk to me, when you talk to your clients, when you talk to physicians. We are who we are.
Right.
But I feel like this nurse practitioner is, maybe her personality is always very quiet and very, I want to say clinical, but very information based.
Mhm.
That you don't see a lot of personality or drawing. Like, I have no problem drawing from personal experiences. You just brought in Susan's experience.
Right.
And I absolutely agree with you. Something is changing where the surgeon isn't available. There should have been a phone, unless it just happened in the last half hour,
No. But to go back to your daughter, again, where is the patient support component of that conversation? Where is, this must be really concerning to you. Yeah, I know that this is your first child and you haven't
Right.
had this before.
Yeah.
Take
Yeah.
a deep breath. We're going to
Mhm.
work through this and it's going to be okay. Where is that conversation?
Right.
Again, and I get everybody is busy. It's funny, when I worked on engagement, people would say I have no time for engagement. It's part of what you do.
Yeah, right.
It's how you lead. It's how you manage. It's not an extra thing.
Yeah.
It's the manner in which you do it. And it's the same thing with patients. It's the manner in which you're talking to the patient.
Yeah, I always say that. It's all in a delivery. It's not what you're saying, it's in the delivery. Yeah.
It's a delivery. And there isn't one patient, I can promise you. Not
No
one.
pun intended.
But there isn't one patient that isn't looking for support. They're not looking to hear that, I'm in it with you and we're going to work through this. There isn't one person who wants you to say, hey, I'm not in this, I don't care. No, everybody wants to know you're on their side. Everybody.
Yeah.
And it doesn't matter if you're the nurse, it doesn't matter if you're the respiratory therapist, it doesn't matter. They want to know that you're there to take care of them and that you're empathetic.
Yeah.
It's just, there's really a lot of it missing. And it's partly to blame because of the expectations, like doctors, you got to see so many people a day, you got to do this so quick, you got to document, you have so many, and everybody's trying to be productive. And the key is, how do you be productive and still be able to provide those things? And they may be as silly as, what, I know you're really concerned right now, I actually have a lot to do, but I'm going to come back before I leave. And you go back for 5 minutes.
Yeah.
It goes such a long way.
Yeah.
Such a long way. Yeah.
You're talking to me. You're talking to my soul, because I believe in this so much. And I think as you were talking, I was thinking of all my favorite practitioners, and that was it. That's what they
do. And if everybody's practitioners, as a healthcare provider, when you go to talk to a doctor, what do you want to hear from them? Really? It's just, it's common sense, but it's not, here's the issue. You get results on what you manage, and people are managing productivity. People are managing finance. They're not managing how did the patients feel. Now they're starting to. There's a lot more with all the different surveys and stuff. Unfortunately, the surveys, you get more negative, because when you ask somebody how they did, if it was just okay, they're not writing to you. If it was great, they'll let you know. But if it's a little bit bad, you're going to hear about it, right?
Yeah,
so
right. It's like the politicians. It's like, they really can't focus on what's happening and that it's good. It always, you know, they complained about Reagan, they complain about Trump, they complain about Obama. That's more what you hear. That's what
Right.
sells. Yeah. Yeah.
Right. Because people want to feel, I don't know why. I mean, now we're getting into a whole different conversation. Uh, but, and I know our time's up. But anyway, so the reality is, let's start with, remember there's a new decade coming.
Yep.
And now's the time. If you haven't done a vision board, I don't know if people have done vision board, put together a vision board for yourself
Nice.
before you start looking for a job and seeing what does it say about you, what talks to you, and leave it somewhere. I have a vision board that I did, I guess, 8 or 9 years ago that I still
Mhm.
have, and I
Nice.
still, and it's still real to me.
Nice. Oh, I like that. I like that. And I would say so many things that we talk about when we're talking to the employee, I think stands true for the employer too.
Of course it
You
does.
know,
Yes.
when you're meeting with your recruiters and your marketing team, say, look, this is our ideal. This is our ideal to have whatever it is. In some cases, it's like what you are hiring thousands of people, right?
Mm-hmm.
This is what we need in this department. And then even the people that just need 5 people to run their clinic, whatever. But this is our vision. This is what we're looking for. This is our culture. Bring all those pieces into it. So,
And trust me, skills or tasks are easy to teach.
mhm,
Critical thinking, kindness, patient empathy are not.
right.
So if you've got two people and one's super skilled and abrupt and a bit of a, Nurse Ratchet, and then you have another one who may not have as much skill but is kind and empathetic and
Willing to learn.
willing to learn, has critical thinking skills, I would bet on that person every time because
Mm,
the skill will come up to where it needs to.
mhm. Yeah, I love it. And I agree with it.
Even better.
Okay, Mayor, I'm so happy to see you. I know everybody else is as well. And we'll let everybody know what today is already Friday. Good
I
grief.
know. It's
Yeah,
outside.
it's Friday and it's the 13th. Yeah. Oh my gosh, it's Friday the
The
13th.
13th.
That could be lucky.
Yep.
Um, so we will try to get together next week.
Absolutely.
And absolutely in the new year, we will be getting together.
You got it. All right,
Okay.
Reeds, have a great weekend.
Thank you, sweetie.
All right, talk to you soon.
Okay, signing off.